Hi there, my name is Justin and I'm here at the Hyperbaric Oxygen Department here at the Center for New Medicine, willing to share some information with you about what we do here and what we offer. So hyperbarics is a treatment that's been around for quite a long time. The first hyperbaric chamber was built in the 1600s. Today our chambers are equipped with a TV and a DVD player so you can enjoy a video while you're in. We also have Hulu, Netflix, and Amazon. As you can see, we have two different types of chambers. We have a lie-down chamber and we also have a sit-down chamber. Some patients have a preference on one or the other. My personal favorite is a lie-down. I like the fact that I can see all the way out of it. It kind of helps me feel a little bit better. Basically what happens while you're in the chamber is you get pressurized. It's very similar to diving, also very similar to flying an airplane, especially when you come in for a landing, and that you do have to work on equalizing your ears by using one of three techniques, such as yawning, swallowing, or the Valsalva technique, which is where you pinch your nose while tremble air out of your nose. Most people describe it as popping or crackling that you hear, and that's completely normal. And what we do is we deliver 100% pure oxygen through a mask. The reason for the pressure is it's a pressure that drives all of that oxygen into all of your bodily fluids. So at normal atmospheric pressure, we're breathing air that only has 21% oxygen. We breathe that in, it goes through our lungs, into our bloodstream. Once it reaches your bloodstream, it's only the hemoglobin that picks up that oxygen and delivers it to the tissues that need it. Your hemoglobin only accounts for about 15% of your entire blood volume. So it's a relatively small amount of blood that carries oxygen for you. When we get you in the chamber, not only are you breathing 100% oxygen, but because of the pressure surrounding your body, we can then get 100% of your blood to carry that oxygen. And it's not just your blood, but the other fluids in your body. So your saliva, lymphatic fluid, it's all getting greatly enriched. The reason this is beneficial is oxygen is the element necessary for any type of healing to occur, which is why oftentimes people with diabetes will have a hard time healing a wound on their foot. It's because they're not getting the oxygen down to that wound site to promote the healing. So when we get them in the chamber, they're able to heal up that wound pretty quickly. This is also beneficial for many other ailments. There's over 200 conditions known worldwide to get benefit from hyperbarics. Currently in the States, insurance will cover for 14 of those indications. Most common is the non-healing diabetic wounds, also the diver-related injury, there's compromised flaps, crush injuries, things of that nature. Typically they're emergency type situations where you're getting treated in the hospital. Here at the center we get a wide array of patients. We get a lot of post-healing from surgeries, athletic injuries, and with those types of injuries we say we can cut the healing time by about 50%. Oxygen is not only the most important element needed to sustain life, right? You can go weeks without eating, days without water, but only seconds without oxygen. So hopefully you can understand why it's so important and how we can help so many different people. We have a few questions here that were sent in that I'd like to go over. And the first one is, are there any side effects and is it safe? And yes, it is a very safe treatment. There are virtually no side effects. Most common is people complaining about how it makes their ears feel. This is something we can't avoid, and typically it gets better with the more you do it. Kind of like an exercise you've never done before. The more you do it, the easier it gets. We always encourage people to let us know what's going on during the treatment so we can customize and make their experience much better. So please don't be deterred by any possible side effects of hyperbaric oxygen therapy. And then it says, can you explain the complementary treatments that go with hyperbaric treatments? This is one of the nice things about hyperbarics is hyperbarics can improve the effectiveness of any other treatment that you're doing. So here at the Center for New Medicine, we offer a wide array of treatments, and whenever you incorporate hyperbarics within the same day, you improve the effectiveness of those other treatments. One example is high-dose vitamin C. When you do that in conjunction with hyperbarics, you get like a hydrogen peroxide inside the body, which is just another tool that we can use to typically treat cancer patients. We get quite a bit of cancer patients who come in here, and it's hyperbarics is looked at as an adjunctive therapy. So oftentimes when people go through chemo or radiation, they can kind of help you to feel better from the side effects of the chemo and radiation. Hyperbarics is also the only known treatment for what's called radionecrosis, which is death or damage to tissue as a result of the radiation. So oftentimes our patients will relate that they feel much better, have more energy, sleep better, and feel more productive during the day. One question here is hyperbaric therapy new? And as I mentioned, no, it's not a new treatment. The first hyperbaric chamber was built in the 1600s, and so we've been doing this for a long time. We know the effectiveness of it, and we know that it is very safe. Is hyperbaric therapy only approved for scuba-related injuries? No, that is not the case. There are 13 other indications that are approved for insurance reimbursement, and worldwide over 200 that are known to get benefit from hyperbarics. I don't fall into one of these recognized conditions. Can my doctor still prescribe hyperbaric therapy? Yes, you do need a prescription in order to get hyperbaric therapy. The FDA has declared pure oxygen to be a drug, and so that's why you need a prescription in order to obtain it. Once you have a prescription, you can come in and we can start treatment right away. We're very flexible with our scheduling here. Oftentimes we can get you in the same day without a problem. This question says, I read about a celebrity who sleeps in a chamber to slow the aging process and help with insomnia. So a lot of people have heard about Michael Jackson getting treatment in a hyperbaric chamber. There is reports that he slept in it, and which might be the case, but I'm sure he would wouldn't go in the chamber longer than an hour, hour and a half. Hour and a half is the longest treatment we do here. It's not something that you would want to do for 8 hours. Too much of any good thing can become bad, and so that's why we have a limit of hour and a half long treatment. Michael Jackson got treatment for a burn that he sustained on a Pepsi commercial, and so that's why he got hyperbarics. It helped him to recover that much quicker so he can get back into doing his thing. One thing here is a question about claustrophobia. I think everybody deals with claustrophobia to a certain degree. The fact that we have chambers equipped with an entertainment system really helps most of our patients. As I mentioned, you can choose either a DVD, you can bring in your own DVD, you can choose a program on Netflix, Hulu. Any of those things really help to have our patients go through the treatment. Some patients who are really claustrophobic don't like the idea of having a mask attached to their face, in which case we'll allow you to hold your mask. This can also give you a sense of control, make it a lot easier to go through the treatment. This question is hyperbaric therapy covered by insurance? The answer is yes. Insurance does cover 14 different indications. However, it's pretty rare that we would get those. Again, most commonly, it's an emergency type situation where you're getting treated in a hospital. While in the chamber, will I need a mask? And the answer is yes. So here at the center, we pressurize the chamber with air. We deliver 100% oxygen through a mask. The reason being is oxygen is a necessary element for fire. And so when we pressurize the chamber with air, it's a much safer treatment. There are some hospitals that will pressurize the chamber with oxygen. However, it's a bit more risky that way, in which case when they treat their patients, they don't allow them to wear their own clothing. They have to wear a gown. Women cannot wear makeup, no hairspray, any of those things. So because we pressurize the chamber here with air, we can be a little bit more flexible with our rules. As long as you have a minimum 50% cotton, you can wear your own clothing. And really, the products we're trying to stay away from are petroleum type products as far as makeup goes in that. This question is, I have diabetes with poor circulation in my legs. How hard is it to enter the chamber? Again, because we have the two different options, we can accommodate most, if not all of the patients that come in here to the center. Depending upon your preference, some people find it easier to get in the sit down or the lie down. It's completely up to the patient, and we do our best to help you out, get in there, and we do see amazing results with the non-healing diabetic wounds. So I'd greatly recommend that you come in, give it a try, and look forward to the benefits that you can receive. How does it feel when the chamber is pressurized? So the only way you really feel the pressure in the chamber is on your ears. You don't really feel it bearing down on your body or anything like that. And it's really just the first few minutes, what we call the travel time, while we're trying to get you to the level of pressure that we want you to be at. Once you get there, you just feel like you are out here. There's no difference. So again, during that first 5 to 10 minutes or so, you'll feel that popping and crackling in your ears as you're working on equalizing your ears by using one of those 3 techniques. And then at the very end, when we begin to release the pressure, you feel the same thing. However, your ears tend to clear much easier, and most times just clear on their own. This question is, what should I wear for my treatment? So we recommend that you wear a minimum of 50% cotton per article of clothing. Something comfortable, something that is light. The temperature does tend to increase a few degrees inside the chamber. But if you came and you forgot, you don't have, you're wearing a polyester or something like that, we can always provide you with a gown. This question is, do I need a prescription? I think we already covered that. Yes, you do need a prescription. And if necessary, you can come and see one of the doctors here at the center. We'll go over a quick evaluation with you, see if there's anything that would prevent you from going in the chamber, and write you up a prescription. This question is asking about one of the favorite stories that I have here at the clinic. I've been here for 6 years now, and my favorite testimonial is from a young boy who came in. He was a twin. He was diagnosed with autism at a very young age. He had a twin sister who was not affected, and this young boy had typical symptoms of autism. I would say he was more on the severe end of the spectrum, and he was sent over by a physician by the name of Dr. Jerry Cartsinell, who had him doing many different modalities, worked up a diet plan for this child, and hyperbarics was just one of the treatments along with the program. And right around 20 treatments, this child had a complete reversal. He was no longer diagnosed autistic. He began to create eye contact, carried normal conversation, and it was just amazing to be a part of that story. That's one of the stories that really sticks out to me the most. And if you'd like, we'd encourage you to come over, give hyperbarics a try, and see what we can do for you.
Thank you so much, Justin, for sharing. If any of you have any questions or comments, please contact us in the email that I'll provide in the comments. Thank you.